Hi, my name is Ana Santiago, and in this video I'm going to be talking about couples therapy, family therapy, and individual therapy, and what is the difference between these. Also, how the modalities that we have worked in this course apply to each. For individual therapy, we focus on emotional coping skills, the client's thoughts, the behaviors, and something that is very much used for individual therapy is cognitive behavioral therapy, person-centered therapy. So in this therapy, the counselor has to build a strong alliance with the clients, a focus on self-reflection, growth, achieving the goals, healing individually. And the goal is to improve emotional regulation, awareness, coping mechanisms, deal with depression, anxiety, trauma, self-esteem. So while individual therapy is very powerful for the individual, it doesn't necessarily work directly with family constellations, family dynamics, or other relationships. When it comes to couples therapy, it centers around the relationship rather than the individual for communication and solving conflicts. So for example, modalities like the Gottman method are very useful for dealing with this type of therapy. Is for enhancing emotional attunement, reducing destructive communication patterns as criticism and defensiveness, knowing what are the reasons why the couple may not make it, for example, and building a strong relational foundation with interventions such as love maps and a sound relationship house. Also have emotionally focused therapy, evidence-based approach that helps. So the goal with this is to improve relational satisfaction, rebuild trust, and create lasting emotional bonds. Couples therapy is different than individual therapy because it focuses on the couple per se and their actions towards each other, their relationship, instead of just a person focusing on themselves. Then we have family therapy. So it's a system approach, what we're looking for, and we're looking for how the members contribute to the family system. So Adlerian family therapy is one that works for family therapy. It's based on Alfred Adler's work. That emphasizes on family constellations, for example, birth order, mistaken beliefs develop in childhood. It helps family members identify and change dysfunctional belief patterns, cooperation, and encouragement. There's also the Bowen's that focuses on intergenerational patterns, differentiation of self, and emotional cutoffs. The genogram is a key tool used in this type of therapy. The goal is to help individuals develop autonomy while maintaining also the family connections. We also have Salvador Minuchin, structural family therapy, talks about the subsystems, for example, parental, sibling, and the boundaries. So these techniques include joining and reframing, enactments to help the family reorganize their structure. And what this does is that it establishes healthier family hierarchies. Then we have Virginia Satir's model. It focuses on self-esteem, communication styles, and congruence. So some techniques that are used are role-playing, family sculpting, to improve emotional expression and authenticity. The goal is to increase the self-worth and improve communication patterns among family members. We have cognitive behavioral therapy, integrates cognitive restructuring, behavioral techniques, very useful in the children of the family and helping with their behavior. Their interactions with their parents and amongst siblings. It helps families develop a more adaptive interaction patterns through psychoeducation, role-playing, skill-building techniques, etc. And then the goal is to reduce the family conflicts and improve problem solving amongst the family. So the importance of understanding differences between individual, couples, and family therapy is that each approach requires different techniques. For example, the henogram of Bowen versus restructuring boundaries in structural family therapy. So misapplying an intervention could be ineffective. You use an intervention that doesn't go with that situation, is not gonna solve any problems. Also, the systemic perspective is necessary. Individual mental health problems may come from a family, a generational problem. It requires an approach that can deal with generational problem rather than just symptoms. So integrating the right preventions for the right settings is going to improve the counseling experience with the individuals, the couples, and the family. Thank you for listening.